opportunity to play a central role in coordinating this work across the Commonwealth and serving as host sites for the operations of the administration of the vaccines. Here with me today from the Pennsylvania Association of Intermediate Units is Dr. John George and Dr. Mark Hoffman, both who have been an integral part of the statewide vaccine initiative. In addition, the BCIU pandemic team is in attendance this morning, who I would like to personally extend my gratitude for their countless hours that they put forth to make this important vaccine initiative a success. We also extend our appreciation to many other partners who have made an impact in this initiative and are critical to this effort. The Pennsylvania Emergency Management Agency, the Pennsylvania Department of Health, Pennsylvania Department of Education, the Army National Guard, and AMI Health Services. Over the past several days, we've seen how smoothly medical operations is running, which is a testament to the state's leadership and the professionalism of AMI staff who are on site administering the operations of the clinics across the state. We've also had tremendous support from our public and non-public school officials, as well as local county emergency services, local law enforcement, our elected state and county officials, and additionally, the administrators, educators, and the staff are extremely thankful for the opportunity and know this is a step in the right direction for Pennsylvania schools. Here with us today, representing our school superintendents for those across the Commonwealth, is Dr. Khalid Momeen, Reading School District Superintendent and Pennsylvania Superintendent of the Year. In addition, we are joined by several teacher leaders representing the many educators across the Commonwealth who are thankful for this vaccine opportunity. Ms. Rebecca Titus from the Reading School District, Ms. Bernice Crutchfield from BCIU, Mr. John Ford from BCIU, and Mrs. Diana Kay, an early intervention teacher for the BCIU. Again, we are honored to have Governor Wolf with us today, and on behalf of the educators across the state, we would like to thank you for affording us this vaccination opportunity. And at this time, I would like to officially turn the program over to the Honorable Governor Tom Wolf.
Thank you, Dr. Heckman. And I realize that I'm probably pushing it a little bit without wearing a jacket here. There are a couple of us without jackets. That's good. But it is March 15th, and spring actually is going to be here on Saturday. So this is great. But the celebration really is about what's going on in this building. This is a really important process of getting our teachers, our educators back to school, and getting our kids back into the classroom, which is a really important thing. So I am pleased to be here to help celebrate this really major event in the life of Pennsylvania. And I want to thank everybody who has worked so hard to get this site up and running. Sites like this all across the Commonwealth, I think there are 28 intermediate units all across the Commonwealth that have been set up quickly, and we've already vaccinated 55,000 educators throughout the state. They will be working through Thursday, I guess, here, and it's just amazing that about 5,000 will be vaccinated when all is said and done. I think those are the right figures, 5,000. So this is really great. It was less than 2 weeks ago that the COVID-19 Vaccine Task Force, again a bipartisan task force, announced our intention to use the first doses of the newly approved Johnson & Johnson one-dose vaccine for this purpose. We chose to take advantage of the flexibility that this particular vaccine provides to allow us to swiftly implement a vaccination program for school employees. I think I just split an infinitive there. I shouldn't do that in a meeting. Sorry about that. And it's only through coordination with Pennsylvania's intermediate units and the National Guard and the education groups that we're able to get all these sites up and running so quickly. Of course, as Dr. Hack has pointed out, the AMI has been a big part of this, so thank you. But this all is in the effort to keep our staff and our students safer, to get them back into the classrooms faster, and to get our communities closer to normal, as one step closer to that normal that we're all trying to get to. The vaccinations that began at the intermediate units throughout the Commonwealth this week and will continue, and we're prioritizing vaccines for teachers, and will stop the interruptions that have hurt not just the students but all of us in the education process. Schools also provide, we can't forget, key support for many students, like nutritious meals. In addition to serving as crucial locations for students to build friendships, play with their peers, grow, establish those social abilities that make life and make professional life that are so important to professional life and jobs and careers. Getting students back into the classroom reliably is the first step to repairing educational and social deficits that we've all built up over this past year, and putting all of our students on the path to future success. That's what happens when we get them back into the classroom. So vaccinating teachers and staff not only protects our schools, it helps entire communities, it helps the entire Commonwealth get back on track and get one step closer to normal. We all know that parents and caregivers have faced impossible choices over the past year, balancing jobs, childcare, learning and support duties all at the same time. That's just an impossible task. But families have been forced to juggle these competing demands for months on end. So it is really great that we can now see the light at the end of this tunnel. Getting the youngest and most vulnerable students back into the classroom will help lift some of the burdens that families have been facing for the past 12 months, and it's going to protect entire communities. We are preparing for the second wave of educator vaccines in a few weeks. Pennsylvania's next allocation of Johnson & Johnson vaccine. Now, just to keep in mind that Johnson & Johnson folks, the federal government promised us 0 vaccines from Johnson & Johnson last week. The nation got 400,000, so they under-promised and over-delivered. They're promising 0 this week, and so we'll see where that comes in. We'll find out tomorrow what the number actually is, but we're assuming that it's 0. So the next batch is the last week in March, 2 weeks from now, and they're proposing to send out a whole lot of Johnson & Johnson. We'll be able to get back on track. The idea is at that point we'll be able to finish the job with the teachers and educators who deal with the older children. But all of this special initiative will help protect our communities. It's going to take burdens off, I'm concluding here, parents and families, and it's going to make schools safer, faster. So I want to say thank you to the parents and families who have done so much to support students over the past year. Thank you to the teachers, all the educators who have moved mountains to provide innovative learning opportunities for our students through this really unusual time. And thank you to all of those who have contributed to getting vaccine clinics like this one up and running. This is an important step in Pennsylvania's vaccination journey. And after a very hard year, vaccination clinics like this is one more thing that gives us all hope. It reminds us that the vaccine supply increases, we are going to get through this pandemic. We really are. So thank you. Now I'm proud to turn this over to AMI's Executive Vice President, Mike Smith. Mike.
Thank you, Governor. Good morning. I'm Mike Smith, Executive Vice President of the Testing and Vaccination Division at AMI Expeditionary Healthcare. We're a unique organization delivering medical service to some of the most remote and challenging locations in the world. In 2014 and 15, we ran Ebola hospitals in Liberia, and right now we're operating a COVID-19 hospital for the World Health Organization in Ghana. We're one of the first companies to be involved in the COVID response, working for the U.S. Department of Health and Human Services, deploying personnel to the West Coast. What makes AMI different is that we're owned by doctors and led by doctors. We are purpose-driven with a mission to respond quickly and deliver medical services anywhere in the world. We're very proud to be working with our partner Constellus here on the front lines, supporting the Commonwealth of Pennsylvania's effort to vaccinate over 94,000 teachers and school workers in just a matter of days. It's been a great pleasure to work with Pennsylvania Emergency Management Agency, the National Guard, Department of Health, Department of Education, and other stakeholders in setting up these vaccination clinics and IUs across the Commonwealth. This ambitious rollout began last week, starting at 2 locations, and then within 3 days we were operating from another 26. Most of the sites are set up to do 500 doses a day, but we also have 2 sites that can do up to 1,000 a day. The full operations should last about 10 days. It's an incredible achievement when you think about tens of thousands of school workers will be vaccinated in just a matter of a few days. This effort by Pennsylvania is in keeping with President Biden's push to return children across the country back to the classroom. I don't know about anyone else, but I'm ready for my kids to go back to school. We're proud to be helping this initiative, and none of this would have been possible without PEMA, DOH, PDE, and the leadership of Governor Tom Wolf, state and county officials. Thank you. Now, it's my pleasure to introduce Senator Judy Swann.
Good morning, everyone, and welcome Governor Wolf, and thank you for making possible and visiting our Berks County Intermediate Unit Educator Vaccination Clinic. This is a good day for our teachers and school personnel and our students. It's a huge step in ensuring that we get them back into the classroom. The impacts of the pandemic may be felt for years, some of which we don't even know what they will be. But we certainly know that our children have suffered. Some of them have not been in a classroom for an entire year. And despite the heroic efforts of teachers and administrators and parents, virtual school isn't the same as physically being in a classroom. A year into this experience, we don't know exactly what normal is, or as many of us say, the new normal will be like. We do know, and we are proving here today, that we must do whatever we can to quickly restore normal life and learning for kids. And that means fully reopening our schools safely. That's easier said than done. And we have a lot of work to do to restore for kids the learning, the social and mental growth they desperately need. I look forward to supporting the innovative efforts of school districts to jumpstart that learning process. But first things first, thank you to the Intermediate Unit for supporting this vaccination clinic. Your leadership in all things educational is very much appreciated. And thank you to the teachers, school support staff, who will hasten the return to the classroom by getting vaccinated. I'm more confident than ever that we're on our way to a brighter future. And I can tell you what, I can't wait to get stuck behind one of those big yellow school buses like the one behind us. That's what the new normal will mean to me and to so many others. Thank you so much, and I am proud to introduce my colleague, State Representative Mark Rossi. Mark?
Thank you, Senator Swank, and thank you to everybody for coming out today. What a difference 1 year has made here when the pandemic has started and the teachers had to go to teaching our students virtually to where we are right now, where we're going to get them vaccinated to get our children back into school. In the 126th district, I've heard from my parents, and the two things that they always talked about was, and what they were concerned about, was the mental health of their children and the overall academic performance. Our children, they need structure. They need balance between home life and school life. And they need that social interaction that they get with other students and teachers. And we have to put our children into an environment that is conducive to learning. And that means they need to be active participants in a classroom. So what we're getting done right now, and thank you, Governor, and thank you for everybody that's participating in this, is that we're going to be able to get our children back into the classroom where they belong. And to me, Pennsylvania has no greater asset than our children. So thank you, and I just want to welcome our Governor back to the podium.
Thank you again, Dr. Hackman. Thank you, Mike. Appreciate that. And thank you, Senator Swank and Representative Rossi. Thank you for everything that you've done. And I appreciate the partnership we have in Harrisburg. And I appreciate what everybody is doing here to get our schools back in open. So you're okay, right? Yes. Everything worked out all right? That's good. All right. So be happy to open this up to questions. Yes, Jim.
Circling back to the announcement on Friday, And is there concern of a false hope when you say everyone in 1A will be scheduled by the end of the month? And I'm talking to several providers and looking at their list and what they're getting. I mean, they're looking at literally 4 to 5 months that they'll have to be scheduling based on what they're getting right now. Is there a concern that people hear this and think, oh, I can get an appointment? That appointment's going to be so far down.
Yeah, I don't think so. I think, I mean, obviously we're moving with an ambitious goal, but I think we have every reason to believe that we'll be able to do that. The numbers I look at actually suggest we can do that. The last couple days, the last day, and I don't know what we did over the weekend, there's usually sort of a sport there, but on Friday's numbers, we did 150,000 vaccinations in one day. So we know that the logistical system has the capacity to do what we needed to do to get to that goal. We also have a sense of what, in a very conservative way, is coming in terms of vaccines. And as I said, we have possibly a lull in the Johnson & Johnson distribution, but the Moderna and Pfizer have increased and continue to grow in terms of what we've gotten, and I'm expecting that will continue to grow through the end of March and early April. In fact, the federal government has said that the national distribution will be in the 20 to 24 million per week range. Now, if we get to that, and you look at Pennsylvania, and again, Pennsylvania has both Philadelphia and Pennsylvania. So we're right now, just Pennsylvania is getting between 400,000 and 500,000. That doesn't include Philadelphia. That does not include the federal partnership. And so when you put all those numbers together, just Pennsylvania alone, not Philadelphia, not counting the federal partnership, should be in the 800,000 to 1 million doses per week just in Pennsylvania. And as we get to things like that, we can start to move back and make promises like, yeah, we will have a point where we can say by 2 weeks from today, everybody in 1A, 65 and older, everybody in 1A will be able to at least say they've gotten one vaccine, or they will have made an appointment within a reasonable period of time, not 5 months out, a reasonable period of time to get the vaccine.
But that's what we're looking at. That's what we're looking at right now with the county numbers, with the southeastern PA county numbers, with what they have signed up on their registries right now. And I mentioned on Friday that Montgomery County is just now scheduling people who signed up on January 14th, and all the counties are in the same boat, including Berks. They all have thousands.
I think
but my question is: there going to be more vaccine coming in to speed up that?
There already is, as I mentioned on Friday. To your question, January 15th, we're in a very different place. On January 15th, we were getting 5 million doses a week. We're now up to, as I said, by the end of this month, over 20 million per week. So we're in a very different place than we were back in January 15th. Also, we don't know how many people on those waiting lists are the same person, but down in 2 or 3 or 4 or 5 different lists. Those lists are dropping really quickly. Right now, the national average percentage of the population is 21%. Pennsylvania is 22%. We're above average. On the second doses, we're at the national average. So, I think, things are getting better and better. There are more and more vaccines coming, and as that happens, we can do things now that we couldn't back in January 15th.
But the number of vaccine on January 15th isn't relevant. What I'm saying is they're just now they have so many people sign up on the list, they're just now getting to people who signed up on January 15th. So project that forward. And they can only schedule based on what they're getting now and what they're expected to get in the next 4 weeks. So when you do the math, and I don't mean to take up all the time here, I apologize, but when you do the math, they're saying, and everyone who has these large lists is saying, they're going to have to schedule 5 months out.
I think you have to see all the numbers to do the math. The numbers are that we will have enough vaccines to do this.
So really quick, and then I'll let somebody else take the mic. Is there expected to be help coming into, especially southeastern PA, where you have these massive numbers still waiting? Is there expected to be more vaccine, whether it's more of these FEMA sites, whether it's a National Guard site, one of these large clinics? Are you expecting to do that to help get those numbers down so people aren't scheduled 5 months out?
Well, and that was what Friday's announcement was about, that we are going to have sites in counties, again, using this Johnson & Johnson, the extra vaccines that are going to be coming in. So yeah, again, it's helpful to look at the numbers from the state's, the full state's point of view. We are getting lots of vaccines. The supply is still not up to demand, but at the rate we're going, that's going to change fairly quickly. Yeah.
When the vaccine first started rolling out, the state obviously came up with a very detailed phased plan for how it would be distributed. Since then, however, that plan has been altered with the expansion of A1 and now with this program. I hear a lot from the public sentiment about feeling that people are skipping the line or the rules are being changed, and there's a lot of frustration, particularly with the expansion to the 65 and older, which added a huge influx of people when there was not nearly enough vaccine to get everybody who wanted one a dose. Can you talk a little bit about why, kind of on the fly, those decisions were made to change that initial plan?
Well, the situation keeps changing. Again, the amount of vaccine has risen dramatically that's available to the states, and that seems like that's going to continue to happen with all the things that the federal government's doing. In terms of moving from, I think, in 1A from 75 to 65, that was actually done at the federal level, and we went along with that. And again, the issue is you have a limited supply of vaccines, and you're doing the best you can to make sure those vaccines do as much for the community and the Commonwealth as possible, which is, again, a good case in point is what we're doing here with the education community. Think of what this does for the Commonwealth. One shot in the arm of a teacher can mean, many students can now come back to the classroom. Many parents can now have their days freed up. So I think we keep, things keep changing. The president just changed things last week by saying everybody who wants one should be able to sign up for a vaccine by May 1st. I mean, if you go back to January 15th, that would not have been possible. But now it is, and looking at the numbers that we have in Pennsylvania, I think that's a reasonable target for us to get. So basically, there are no priorities when we get to a month and a half down the road from where we are right now. Those things are always changing because the supply keeps changing, the environment keeps changing, the numbers of COVID keeps changing. All those things mean that we need to keep changing the way we're doing things to try to get as many people vaccinated, get ourselves, do everything we can to get ourselves back to normal as quickly as possible. Thank you.
One more. Morning, Governor. Is there a particular reason that you chose the Berks County Intermediate Unit to visit today? Is there a particular need that you see here in the area?
I'm not sure why. I think they were kind enough to invite us to come here.
Okay.
Certainly isn't because it's a warm day. But no, I think it's just a good example of what's going on all across the state. As I say, 28 intermediate units across the state have been set up and are doing what they're doing here at the Berks County Intermediate Unit, and this is just a great example of what's going on all across the Commonwealth.
Thank you, Governor.
Thank you, everyone.
Thanks a lot.
You did a great job of that. You're doing a great job.
I thought we were going to be. Hey, you didn't have to.
Yeah, I think so. Thank you. No, this is good. Travel safe. Thank you.
Amen.
Thank you.
Governor, our teachers wanted to say thank you to you, and again, your guests, Ms. Kay and Ms. Titus, and the two are feeling great. Yes, Dr. Momin, yes, and he provided, one of his teachers invited her, so thank you. Yes, thank you.
I'm the association president.
Yeah, we have our leaders here who are very supportive. So both association presidents, one for the IU, one for Reading, and again, just very thankful for this opportunity.
Question about why I chose the Berks County Intermediate.
I know your answer was perfect.
I should have said this is the finest.
We'll just keep that our little secret.
You already know it.
Well, listen, no, because all 28 are working hard and all 28 are offering across the state. So it's perfect. Thank you very much. All right, we know you're cold. I know. Senator, is there anything else you need?
I just wanted to say a word to the governor. I totally agree. What is Mrs. Wolf? I didn't think so. Glad to hear that.
Feel free to stop by. Let us know.
Very good. I understand the message. We worry about your health as well. So, all right. Thank you. I'm sorry about that. All right.
It's like shivering up there. What? Rain at the end of the week would have been a mess. Yeah, that's what that was.
Even I can't.
Well, sort of. The hair's not going too better than yesterday. Yesterday was like crazy.
It worked, yep.
All right, you got it.
You said you guys are all back in the office now? We've been open in the office, but I've been still taking spaces. I don't have to be there. You can work a little better remotely. County needs I say I'm our designated provider. If things go bad with the staff, still here.
our pandemic coordinator, and she's been working closely with the AMI team to make this whole thing happen. So, only 100 shots are going through. How would you guys identify them? We feel honored and fortunate by her leadership. So. All right, we're going to do the more, right? Is that the next thing, right?
Good luck, sir. Pleasure meeting you. Thanks, sir.
Real quick, Dr. Robertson, can I have you jump in here with us? You're our pandemic coordinator.
Yeah, you need to get in.
Yes, you do. Here, stand up here in front of these two tall guys. Thank you. Awesome.
Here we go, everybody.
Okay. Thank you. All right, Governor, thank you. Dr. Robertson, you know.
My budget. Yeah. And that's the picture. Oh yeah.
Look at that. So he's going to get your autograph,
Yes.
Governor Wolf, for this. You know.
And I understand.
If your hands still work because it's so cold out.
The gift policy, so if you could accept one, I have.
This is a vaccine clinic.
I'll pay you. I'll send you a check. Yes, sir.
Watch it, Dr. Bobby.
That's great.
I'll connect with the lawn to make sure.
Okay. So I'm worried about that.
I know.
And this copy's for you.
Alon, we'll make sure we get the invoice. Dr.
Can I have a picture with the governor?
Yeah, let's go. We'll get you one right here. Do you have your cell phone?
Here we go, everybody. Yes, count of three.
Yeah, you want me to take one of these?
Yes, ma'am.
With his
I know the governor's hands are cold because mine are just.
He's a good.
By the way, I'm going to pay for this. I don't want anybody to be under any mischief. All right, guys, here we go. Count of three. 1, 2, 3. One more, just like this. Here we go. Looks like we got everybody.
All right. Thank you, Governor. Thank you, thank you.
Dr. Momi
Is running to his car.
He said he'll send a check.
Get the book.
Thanks, Alon.
Thank you.
All right. See you later. Thanks for
Thank you.
everything. Yeah.
Thank you. Thank you. Thank you.
I'm going to walk back inside.